Health and Indian Institute of Diabetes. Over to you, sir.
And at the outset, let me thank the organizers for giving me this opportunity. I thank Dr. Lali Madam, Arun, and members of the AMS, Pradeep Kadangur, and the IMA office bearers, Vijayishan and Altaf. Let me place on record my sincere thanks to Professor V.M. Pradeep, who introduced me to ultrasonography in 1986. Let us start. Ultrasound is an imaging technology that uses high frequency sound waves to characterize tissues. Ultrasound relies on the properties of acoustic physics that includes compression, rarefaction, reflection, impedance, etc. of the sound waves. These are all utilized in ultrasonography. As you all know, this is the ultrasound examination being conducted. Ultrasound is sound with high frequency. The audible range is 20 Hz to 20 kHz. The frequency of ultrasound used in medicine is 1 to 20 megahertz. Ultrasound was invented as a part of war defense for detecting underwater submarines, etc. Now it is used for sterilization of equipments, to detect flaw in metals, etc. It has wide uses, but the megahertz we use is 1 to 20. This is the ultrasound machine in Institute of Diabetes. Ultrasound is produced by a vibrating crystal inside a probe or transducer. The crystal has piezoelectric property. It's a phenomenon in which when a voltage is applied, the crystal vibrates and undergoes a series of compressions and rarefactions to produce sound. Vice versa also happens. That means when the reflected sound waves strike the transducer, a voltage is applied, and this voltage is used in the production of an image by the use of computer. The same transducer can be used for receiving and transmitting. What happens to sound waves in the body? Like light, the sound waves are reflected, refracted and absorbed. The reflected and refracted waves reaching the body contribute to the image production. The reflection at various interfaces depends on the acoustic impedance of the various tissues of the body. So, ultrasound consists of the following basic components. One is a transmitter or pulsar to energize the transducer, ultrasound transducers, then a receiver and processor to detect or amplify the backscattered energy and manipulate the reflected signals for display. The display mechanism is by computers, and you get a image in the form of images, or the data can be analyzed for interpretation or recorded. So there are various transducers, the convex array and the linear array. Now high frequency transducers are there, the intracavitary probes are there, even intraoperative probes. The crystal is made of piezoelectric material, usually lead zirconate titanate, PZT. Ultrasound needs a good acoustic window for getting an image of good quality. The solid organs like liver, spleen, fluid-filled structures, etc. provide a good acoustic window. Air, bone, etc. reflects the sound waves and so degrades the image. So appropriate transducers should be selected. That is, for organs in the depth of the body, we have to have a transducer with a low frequency, and for superficial structures we need a high frequency. So Usually a low frequency means around 2 to 3 megahertz, otherwise anything above 5, 7.5. Advantages of ultrasound, because it uses non-ionizing sound waves, it has no recorded risk of carcinogenesis, etc. It is readily available, less expensive than CT or MRI, easier to perform. Images are not adversely affected by metallic objects, as in CT and MR. Disadvantages mainly operator dependence, then it is not capable of evaluating tissues with a high acoustic impedance, that is bone, air, and is limited value in evaluating structures encased in bone like the skull. Artifacts can degrade the image quality. Then for obese individuals it is very difficult. So the principles of interpretation. The ultrasound images are basically black, white or gray areas. Now it is all available in color also. The areas where there are no echoes are called anechoic and appear black. Example, fluid-filled cavities like the urinary bladder, gallbladder or blood vessels. So this is a cyst of the spleen. There is posterior enhancement and the wall is well defined. The areas where there are very many echoes appear white or hyperechoic. Example, stone, calcification, air, fat, etc. So here is the gallbladder with a stone. Only the upper part of the stone is seen. It is bright, and the posterior portions appear with distal sonic. The echoes are black, anechoic behind. When the echoes are in between, we call it gray, or you can say hypoechoic. Example, the soft tissues. This is a breast ultrasound with a fibroid adenoma, hypoechoic. When the echogenicity is same for two organs, we call them isoechoic. Posterior enhancement occurs in cavities. The posterior wall appears brighter than the anterior wall. So this is a liver cyst, two cysts in the liver with posterior enhancement. Then there can be multiple cysts replacing the kidneys, as in adult polycystic kidney disease. The IVU showing the spider leg deformity of the kidneys. The CT scan showing the same. See, coronal view. And cysts may not be all clear always. Sometimes there may be some septae, some internal echoes. So what we have to do is to classify it according to Bosniak classification. It is classically described in the books. So very clear means Bosniak 1, thin septae inside, Bosniak 2, then 2F with some septae, 3 and 4. 4 means nodules with enhancement. So it is classically given in the books. Posterior acoustic shadowing that happens behind dense objects. This actually helps us to identify the tip of the needle also. See, there will be a shadowing behind the tip. So for FNAC and all, we can identify the tip by the posterior acoustic shadowing. Usually it is seen behind the stones, calcification, bones, ribs, etc. Only the upper border of the object is seen. There will be an anechoic area behind the object, because bones do not transmit the ultrasound waves, the posterior shadowing occurs. Then artifacts may occur due to air, reverberation artifacts, etc. They appear as irregular hyperechoic structures with dirty shadowing. Metals also cause artifacts. But we will be able to identify the presence of air by these artifacts. You see, a calcification will be stationary, whereas air will move and will be seen as dirty shadowing, etc. That is very important to identify the presence of air in the tissues like emphysematous cholecystitis, nephritis, etc. Then there are many modes for ultrasound. The first thing was the A mode or the amplitude mode, then it changed into brightness mode, B mode, and later the black and white images turned into grayscale images. So now what we use routinely is the B mode grayscale unit with or without Doppler facility. The ophthalmologists use the C mode for that is the coronal scan for the optic nerve and all. A mode was the simplest type of ultrasound, that is called the amplitude mode. It is used to determine the depth of an organ or the midline in the brain, etc. It was used for identifying the presence of fat in the liver, because fat used to attenuate the ultrasound very much. So if you get a graph, you can identify the attenuation. But now it is not necessary. So this is the C mode, this is the B mode, amplitude mode. This is the amplitude mode for the eye. Where there are interfaces, you get an amplitude. B mode is, as I said, B mode with the grayscale facility. This is the normal liver with the diaphragm, hepatic veins, portal vein, etc. So this is a normal liver, whereas in this image the attenuation is high due to the presence of fatty liver changes. It can be graded 1, 2, 3. This is the normal spleen you can measure, and splenomegaly can be identified. Splenomegaly, this is a case of thalassemia in which the hepatosplenomegaly is seen. Coronal scan in ophthalmology, then motion mode or the M mode, that is time position scanning, which is used by cardiologists for position of the valves and all. This is a fetal image in which the cardiac pulsations are traced. M mode allows evaluation of movement and accurate measurements in moving structures. It is used in echocardiography, coronary artery measurements, vessel diameters, calculating the heart rate manually. Then comes the Doppler. Doppler measures the flow in the vessels. That is measured from the frequency shift. So in the Doppler measures any flow, any movement of the tissue. So Doppler effect is performed in imaging the movement of the tissues and body fluids and their relative velocity to the probe. By calculating the frequency shift of a particular sample volume, example flow in an artery or a jet of flow over the heart valve, its speed and direction can be determined. See, any movement produces color, so the ureters draining into the bladder will produce color. And also the fetus, if you observe, when it solos and all, you get the color images. But usually Doppler is made use of for determining the velocity in the vessels, their block, etc. So the color Doppler shows the direction of flow. Either it is red, it is usually given as red and blue towards or away from the transducer. Then the spectral waveform can be measured. It shows the direction of flow, phases and pulsatility and acceleration of blood flow. Doppler sonography consists of two components. Usually a B mode image is shown and then the Doppler flow is superimposed on the image. This is called duple imaging. So an ovarian mass with some flow and the tracing is shown. It's a diastolic flow. So the velocities can be determined. Here this is power flow in a lymph node. The power flow has certain advantages. There will be no aliasing, much less angle dependence is there, and increased sensitivity for flow detection. The disadvantage is that it does not provide information related to the flow direction or velocity. Now 3D ultrasounds are there for obstetric imaging. You can see the fetus. For cardiac imaging also it is used. And now there is 4D imaging also, that is live. This is the 3D imaging. And now ultrasound can be used for very many uses. One is the currently popular one is now elastography. Ultrasound based elastography permits study of the elastic behavior of tissue through two approaches: strain elastography and shear wave elastography. Tissue stiffness or elasticity is expressed by Young modulus, the ratio of compression pressure, that is stress, and the resulting deformation, strain. So one is an almost normal liver, the values are given. The next is the other side is a cirrhotic liver with velocity. Then pelvic sonography. Bladder acts as a window, acoustic window, displacing the bowels, and you get a good view. But now we can even use transvaginal ultrasound. So here is an endovaginal scan showing the normal uterus and the endometrium. Then this is the ovary, maybe polycystic ovary with the peripheral garland-like distribution of the follicles. And this echogenic area inside a cystic area is a complex cystic area. It's a dermoid, ovarian dermoid. Then the chocolate cysts produce internal echoes, so that this is a chocolate cyst of endometriosis. Now, obstetric ultrasonography is currently very popular, and now we have to be meticulous in the scan, otherwise, and you have to do according to the PCPNDT Act, etc. You have to get all the permission and keep all records. Here is an image, a pregnant uterus with a fibroid in the lower uterine segment. The transrectal ultrasound is there for prostate. The different probes are there, and what you see is an image of the prostate. Then for children, you can pick up the suprarenal mass as in the case of a neuroblastoma. Then neck vessels can be studied by Doppler, and even B mode will give you the flow. And if there is some echogenic area inside this causing the thrombus, you can identify. Then Doppler helps in the categorization of the thyroid masses. This is a case of papillary carcinoma thyroid with chaotic flow. See, because the blood flow is seen in the center and in the periphery. Usually, benign nodules, the vascularity is more in the periphery. There may be anechoic or hypoechoic nodules also. The testicular varices can be identified. Now, color flow gives better delineation with the Valsalva maneuver, etc. A complex ovarian mass. Then identification of structures, normal kidney. Then in the case of children with ALL on chemotherapy, we may sometimes encounter a tumor lysis syndrome in which the kidneys are enlarged, hyperechoic, with preservation of the corticomedullary distinction. This is also the same tumor lysis syndrome. This is a bladder with bilateral urethrocoel, cystic areas, and the IVU showing an urethrocoel on one side. Then breast masses can be identified, cystic versus solid. You can take biopsies, you can know the vascularity. Okay. Then there is the BIRAT staging for ultrasound images also. This is the ALL testis. Both testes are hypoechoic and one is enlarged irregular. Then popliteal lymph nodes are seen as well-defined hypoechoic structures in the popliteal region, lymphoma. The splenic lesion, a hypoechoic lesion in an enlarged spleen, that also could be lymphoma. The GI lymphoma, it can be detected by barium studies, CT, etc. But this is an ultrasound imaging with thickened bowels, which are separated. Sometimes there will be presence of fluid also. Then the neurosonogram, it's a standard procedure now. The anterior fontanelle is used as an acoustic window. Scanning frequency is more than or around 7.5 megahertz. The whole brain is scanned from frontal to occipital region, from the right and from right to left. Then images of at least 6 standard coronal planes and 5 standard sagittal planes are recorded. Then in addition, all suspected lesions are recorded in 2 planes. Intraoperative ultrasound is there. It is dynamic imaging modality that provides interactive and timely information during the surgical procedures. Direct contact with the organ, so high resolution images. Images are not degraded by air, bone or overlying soft tissue. High frequency ultrasound probes are used, 7.5 to 10. The main problem is sterilization. The ethylene oxide gas is used for sterilization but takes more than 24 hours, so only 1 case per day. Then alternatively, sterile probe covers and sheaths can be used. Then pre-soaking transducers in alcohol is practiced. Then FAST is focused assessment with sonography for trauma. You can mainly identify the intraperitoneal fluid, solid organ injury, but problem is it identifies only amounts more than 500 ml. Then mesenteric vascular injuries, solid organ injuries and hollow viscous injuries, diaphragmatic injuries, etc. may be missed. And thoracic ultrasonography for pneumothorax after blunt injury is very useful. Sometimes it outperforms the supine chest radiograph. Then so many things have been described for lung ultrasound. It's a very detailed one. Bat sign, seashore sign, A-line, chord sign, sinusoid sign, stretch sign, tissue lake sign, lung rockets, stratosphere sign, lung point, etc. See, it is very difficult to go through all in this talk. Then you know the endobronchial ultrasound, endoscopic ultrasound, intrapartum ultrasound, then US guided procedures. Finally, we go to the biosafety, because ultrasound is a mechanical energy. The mechanical interaction of sound with cells and tissues has the potential to produce non-thermal bioeffects. The presence of bone within the ultrasound beam greatly increases the likelihood of temperature rise due to the direct absorption in the bone itself and conduction of heat from bone to adjacent tissues. Some tissues, such as those in developing embryo and fetus, are particularly sensitive to energy deposition from ultrasound. So there is some mechanical index, thermal index, etc. So what we do is, the values should be monitored and kept as low as reasonably achievable. Then specialized care and reduced scanning times should be taken, and you should repeat the studies only when and where necessary. You should always think of the possibility of tissue damage. Thank you for the patient hearing. I thank Dr. Adiram Mohandas, who helped me in the preparation of all these slides. Thank you.